Assalamu alaikum warahmatullahi wabarakatuh. Welcome again to the hip region anatomy. We're starting by, last time we started by the bones, and now we're going to the outer surface of the bone, and we talked today about the articular surface here. Okay. This is the hip region. We look at for it before. Now we are talking about the two articular surface. We have two articular surface. The first surface is the acetabulum surface and the head femoral surface. From the acetabulum here, don't forget this is we have three parts of the acetabulum. The acetabulum is formed from three bones: the ilium, the ischium, and the pubis, and we make what we call it the Y shape here. And also we have the acetabular notch. How we cover all of this area? All of this area we have to cover it, and we see what covers this bone, because now when we start to have a joint, we have to think about the forces inside this bone. Between these bones, we have a compression force, we have a tensile force, and we have shear forces, and especially the friction force. These forces could cause a damage of the joint by wear and tear. And that's why we have the joint will be so, the joint tissue will be have to accommodate to all of these forces. Let's see. Now we start to cover the bone, the acetabular cavity. This part, what we call it, the lunate surface or horseshoe surface, or we call it triradiate cartilage. Lunate or horseshoe because it looks like a horseshoe or a lunate. And triradiate because I said before, the Y area. And this cartilage, especially the part of the cartilage of a lunate surface, is very thick at the iliac part from the superior and the anterior, or where the compression force is when the forces is a lot, because all of the body loads coming from upper part, from the head, upper limbs, trunk, going to the sacrum, and from the sacrum to the hip joint, and to the knee, and then the ground, and also the grounding action force taking the opposite direction from the ground up to the hip to the sacroiliac joint. And so that's why the joint have or underwent a very high force, compressive force, and not a compressive force, it's all kind of force. So this is the lunate cartilage, okay? Here, nothing. This is a acetabular notch. It doesn't cover here. Let's see other picture here. Oh, okay. Now now after we make this is a lunate cartilage, we want to complete the cavity. The cavity is completed by the transverse acetabular ligament, or sometimes we say that transverse femoral ligament. I prefer to say that transverse femoral ligament. That's transverse acetabular or femoral ligament connected from the condyles of the acetabular cavity. Two condyles of the acetabular cavity, it connected both of these two condyles. It is a it is a fibrofatty ligament, and also covered by, it is fibrous and covered by fatty and some cartilage, but little. Okay, this this ligament, I said it connects these two condyles. Underneath of it, making it like a bridge, to pass the acetabular foramen. I took it just a moment. I'll talk about it now. Okay. Also, we have to see what that it's ligamentum teres, the ligamentum teres, or we said it the femoral ligament, femoral head ligament. This one is connected. We talk about it in the next lecture, and not in that lecture. But I have to give you a notes about that, like an introduction to it, when we start to talk about it. And here, from the blood supply coming from the intervertebral foramen here. So now we cover the acetabular cavity by lunate surface, and then we complete the cavity by transverse femoral ligament. Here, a very nice transverse femoral ligament here connecting the two condyles, the ischial part of the acetabular part and the pubic part of the acetabulum. Both of these horns are connected by the transverse acetabular ligament. This transverse acetabular ligament, it's not responsible for the stability of the joint because it connected just acetabulum, but it completes the circle and it increasing or deepen the or increase the surface of of the acetabular cavity. However, it doesn't have any contact or any pressure with the femoral head. There is no pressure between the acetabular transverse acetabular ligament and the femoral head. It is we and also now we have to look about the next one because now we have the lunate cartilage and transverse acetabular ligament, and now we form the foramen. This foramen called the acetabular foramen. The acetabular foramen, I said this is from the acetabular notch. The acetabular foramen coming in the same or adjacent to the obturator foramen, where the blood supply enters the acetabular area here underneath of the acetabular cavity from the acetabular foramen to nourish the femoral head. We can look at here this very nice picture to show that this is the back of or the inner side of the ilium, and they cut this part, and now you see that this is the femoral head and this is the transverse acetabular ligament, and here the acetabular foramen. This is the ligamentum teres, where when the blood supply coming from here, this is the obturator foramen. The blood supply coming from here and enter through the ligamentum teres to the head of the femur to nourish it. Here we can see it very clearly. This is a real acetabulum. When you can see easily, this is the acetabulum, and this is the ischial horn, and this is the pubic horn, and under this is the obturator foramen. Here we see this is the obturator foramen, and this is the acetabular foramen. This is the transverse acetabular ligament here, and underneath it, this is the blood supply and also a nerve supply. A nerve supply that go inside to nourish the femoral head through the ligamentum teres. You can see it here. This is the acetabular foramen here, and this is the transverse acetabular ligament, and this is the ligamentum teres, and this is the femoral head, and the blood supply, and all of these going through the ligamentum teres to nourish the femoral head here, and this is the lunate surface. Now we cover the bone, we're going to the cartilage, and then to the ligaments to have more surfaces here. Also, we can see now after we cover the bone by lunate surface and transverse acetabular ligament. I'm sorry. Transverse acetabular ligament. And underneath of it is the acetabular foramen. Now we have a cavity over here. This cavity is the acetabular fossa. This acetabular fossa doesn't have any articular structure. I mean that there is no contact between the femoral head and the acetabulum in this area. This area is filled with what we call the haversian or pulvinar fat pad. Pulvinar means cushion that acts like a cushion for the femoral head, and also it has a good proprioceptive good proprioception for nourishing that sensory information about the hip joint. This is a very important part also for I'm sorry. Here. How to transfer it? No. Hold on. Here, this is the labrum. Sometimes we call it the, okay, no, sorry. I'm so sorry. Hold the moment. Yes, we come back again. I'm sorry. Yes, that is what I want to do from the start. So this is the labrum. Sometimes we call it cotyloid fossa, cotyloid ligament, or transverse acetabular ligament. That's why I remind you now. Do you know that I prefer to the name of transverse femoral ligament because now we have a transverse acetabular ligament. Sometimes you call the labrum as the transverse acetabular ligament because it is connected all the acetabular area from upper part. It's going from all the acetabular cartilage and even over the transverse acetabular femoral before, underneath of it to form this very beautiful ring here you can see. This is a fibrocartilage. This is a cartilage tissue here, and it has two parts, the anterior labrum and posterior labrum. The anterior labrum is the labrum connected to the pubic part of the acetabulum and to the ischial part. The anterior labrum, we said before, the labrum is connected to the acetabulum cartilage. The acetabular cartilage has two parts, have a calcified cartilage and a non-calcified cartilage. The labrum is connected to the acetabulum by collagen fibers. In the anterior part, these collagen fibers are parallel, so it's fragile. It is easy to be teared. However, the posterior part, the ischial part, the fiber is perpendicular to the cartilage. That's why it's strong. Most of the tear of the acetabulum happened anteriorly because it is weak connection between the labrum and acetabulum at that part. The function of that labrum, it increases stability because it increases the articular surface of the acetabulum here, so it increases the articular surface, so it increases the stability. In addition, it seals the femoral head. When it seals the femoral head, protecting the femoral head from any friction with other tissue. So it protects the articular cartilage of the femoral head. In addition, it creates a negative pressure. This negative pressure inside the acetabulum that suck the head of the femur inside and prevent it from going out. So it increases the stability of or add more stability to the hip joint. Here is the labrum. I also, this is a picture of the labrum, and this is also a graph. This is the labrum. It is like a wedge with a wide base and narrow lips. We have two parts of the labrum. We have a capsular part. We can divide it into capsular part and articular part. The capsular part is the layer of the labrum that connected to the capsule or adjacent to the capsule. And this is also the labrum with a wide base and narrow lips here. And this is see this is the labrum here. The capsular part are adjacent to the capsule here, and what here we call capsular recess. This is capsular recess. It's like a membrane, like it's a synovial membrane, has synovial fluid to prevent the friction or add a lubrication to the labrum. And here, the inside labrum is articular labrum here it is have a contact with the femoral head. The labrum is formed under the loads or under the forces. The outer labrum is our capsular labrum affected by the tensile force of the capsule. This tensile force that molding and remolding the labrum out the outer layer. However, the inner layer is molded by the compression force from the head, femoral head. Finally, we will see here the femoral head. Now we finish the acetabulum as this most important one, the acetabulum. Also, we're going to the second articular surface, which is the femoral head. Femoral head, it is about 2/3 from sphere, and all of it, most of it, 80% of it is covered by articular cartilage, very thick articular cartilage to be ready for the big loads that carry from up to down and from down up. Also, we have what we call it fova. This is the fova. Fova is the middle of it is not articular surface, it's not an articular surface. The fova in the middle of the head of the femur, and this is a connection or the antithesis for the ligamentum teres that carries the blood supply and nerve supply for the femoral head, and it's very important, especially in early age, for formation and maturation of the femoral head at that time. Here, this is very good picture about the femoral head. Now we see the femoral head and the fova. That's all about the second layer we take. We took first, sorry, the bone, and then we're going to the second layer, the cartilage. Now we cover the acetabulum and the head of the femur. Thank you for listening, and be tuned for the next lecture regarding the ligaments, capsule, and synovial membrane.